Hey guys, I'm going to be talking about childhood-onset systemic lupus erythematosus, also known as cSLE, SLE, or just lupus. Lupus is an autoimmune disease in which the body's immune system mistakenly attacks healthy tissue in many parts of the body. Childhood lupus occurs before 18 years of age, and it affects about 1.5 million Americans and at least 5 million people worldwide, and it affects mostly women and non-white populations. To diagnose lupus, there are two criteria that they follow. The first is the Systemic Lupus International Collaborating Clinics criteria, which is divided into two categories, clinical and immunologic. For a patient to get further testing, they must satisfy 4 of the criteria and at least 1 from each category. Other tests that can be done are blood test, urine test, anti-nuclear antibody, which is the most common test done for lupus, imaging, and biopsy. The second criteria used is the American College of Rheumatology. Like the last criteria, the patient must meet 4 more criteria to lead to more testing. By following these criteria, it helps limit the error of having the symptoms mimic other disorders. There is no single test to pinpoint the disease. It takes many years before you get diagnosed with lupus. There are 3 treatment options for lupus. The first is physical activity, which improves function, fatigue, pain, and depression. The second is psychoeducational interventions, which improves psychological symptoms of depression, anxiety, social function, and psychological function. The third is belimumab, which is a monoclonal antibody that affects the actions of the body's immune system. The antibodies are made to target and destroy only certain cells in the body. This helps to lower the number of circulating activated B cells in plasma. To the left, the bottom picture shows the butterfly rash, which is one of the symptoms for lupus, and the top picture shows how the belimumab works. To manage lupus, high cardiorespiratory is used to lower the increase of arterial stiffness per each year while age increases. Another way to manage this condition is psychosocial support, health information, education, adherence interventions, personalized treatment plans. These aspects improve quality of life outcome as well as treatment satisfaction. SLE is a complex disease that impacts people at a relatively young age. Improved treatments have resulted in many patients living longer and advances in understanding the underlying pathogenic mechanisms are contributing new insights that hold promise for translation into improved clinical care in the future.